Hello, everyone. Marc Gentili here, the editor of Sudbury.com. I'm coming back to you once again with another sit-down live chat with one of our federal representatives. Today, Marc Serré, MP for Nickel Belt, has graciously agreed to sit down with us by remote. It seems like everyone is using the Zoom video conferencing app nowadays. Everyone I've spoken to has pretty much gotten a crash course in this. Mr. Serré, how are you doing today?
Oh, very good, Mark. Thank you for inviting me to speak to your listeners and your viewers. We got to keep working hard to make sure that people are safe and informed. So thank you for doing this.
Yeah, it's our pleasure. That's what we're here for, is to do as good a job as we can of keeping people informed. I have to tell you, it's a bit like drinking from a fire hose. For the past few weeks, the news is changing hourly, it seems.
Correct. I mean, that's as a federal MP, is trying to make sure I'm on top of what's happening municipally, provincially, federally, so that we can give the best advice, information to people that are requesting it. And again, it's advice. There's people have to take into account their own personal situations, but at least if we inform people, we're transparent and try and make sure that information is available as much as possible, and people can make their own decisions on how to navigate this issue with the COVID-19.
Yeah, and I assume you are getting a lot of questions from constituents. I mean, there's so many programs that have been rolled out for individuals, for families, for businesses. I assume there is a lot of confusion out there about where people are supposed to go, who they're supposed to call, that sort of thing.
Yeah, no, I'm happy you asked that question because, again, getting your source. So when you're looking at Canada.ca, from the federal government, or you're looking at Ontario.ca, or you're looking at your local municipality or the health units, it's really important for people to get the information from those sources. If not, you get a lot of misinformation out there, and so it's good to go back and if in doubt, then email my office, message my Facebook page, also leave voice messages on my offices, because the staff are working to respond on a very prompt fashion all the inquiries and questions that people have. And getting the right information is good. Make sure that we have that.
Do you want to let people know how you want to give us your phone number, Twitter handle, that sort of thing, the various methods that people could use to get a hold of you? Did you want to get those out into the record here so that people know where to go and who to call?
Well, definitely. If you have access to the internet, just by Googling Marc Serré, you'll get a lot of information from a Facebook, Marc Serré MP. You'll see a lot of Facebook, Twitter, Instagram. So that is part. Also LinkedIn. When you're looking at email, then marc.serré at parle.gc.ca. Also the phone number, if you don't have access to internet, I know probably those questions have been asked to me on numerous occasions. By phone, you could talk the 705-897-2222 is one of them to get a hold of. But essentially, the office is not taking anybody physically in. The doors are closed, but we are responding and helping people with their casework on CPP, helping people with tax issues like they had prior to this pandemic. And now we're responding to individuals that have specific questions also about the community and how to stay safe and work. So those are the methods in general to get a hold, but it's continue to make sure that you look at some of the reliable sources to get that information out there.
You were telling me before we went live here that early on you were getting a lot of calls to your constituency office about from people out of the country who are trying to get back to Canada. I assume those calls have tapered off somewhat at this point?
Yeah, definitely the first week or so, I felt like I was a travel agent with the staff, because we were getting calls and inquiries from Australia, France, Peru, India. We had workers, mining companies that had workers in Venezuela. We have difficulty getting people out, obviously, from some of those countries. So a lot of that in global affairs, we've been linking that back. We ask still people to make sure if they're still out there, make sure they register with the government on the global affairs website, because you still have Canadians that are that are stuck in certain countries. So that's still an issue, but it's a lot less pressing in the last few days. Today, for example, we're getting a lot of calls and emails from people that are questioning how to get EI and the new emergency assistance program and do they qualify. So a lot of those calls are coming in today linked to that, and obviously still dealing with a lot of the small businesses that have a lot of questions about making sure they could reopen or stay open. So.
Okay. We'll get to some of that as well. Now, we did solicit for questions from our readers. I had a bit of a technical glitch in that I inadvertently lost the questions that we received. I tried to rebuild the list of questions from memory. I think I did a decent job of getting to them. So, previously I was able to name the person who asked the question. So unfortunately, if you did send a question to me to ask of Mr. Serré, I'm not going to be able to name you. But know that I did receive your question, and I inadvertently I lost it, but I'm pretty sure I got all of them here. So maybe we'll start with some of these questions I received. One person was asking about, and this isn't the first person who's asked this. We've heard this from a few people. Is guys in the mines, people that are working underground. The mines are still open. A lot of all Canadian industry is basically still open. Can you explain why we haven't taken the step of closing industry, of shutting down industries at this time to prevent the spread?
Well, it's important to have still the economy going at a certain point. We have to make sure that people are safe. So that's the first thing. So I encourage a lot of the businesses that are open today, for example, in the mining industry, construction workers, to make sure they work with their unions and the employers to make sure that there's a good cooperation. Health and safety committees are in place, and we want to make sure that workers are safe. There are, you've heard from Dr. Tam and many health professionals that, this physical distance, social distancing, there's ways to make sure we have the proper equipment. So encourage the people that are working right now. On the retail side and on the construction side and the mining side, a lot of this is regulated by the province. And Quebec has taken some measures, Ontario has taken some measures, but they've all been really proactive. When you look at it here, the premiers and you're hearing the mayors, and everyone's trying to make sure that workers are safe. So I would encourage making sure that workers are working closely with their union, making sure we have the proper equipment, protective equipment for the staff as we get through this pandemic. Because again, first responders, health providers, retail workers, bus drivers, cashiers, there's a lot of people working in the mining industry and the construction industry. So we got to make sure that people are safe first. And there seems to be ways to make sure that people respect that. And again, this individually, we have to, my wife works also at Best Buy, and so I understand the concern when you're coming back home. But we have to make sure that we find ways, and please, from a staff perspective, make sure that you talk to your employer, talk to your unions, and if you don't feel safe, then the public health unit is there to support the employer to make sure your workplace is safe.
Have you heard from workers in any industries that are concerned for their safety, or feeling that their employer isn't sort of living up to protecting their level of safety?
Well, most of the inquiries we've been having is I've received quite a few employees on the retail side. I received calls from on the mining too, some of them too on the and some of the restaurants. Now they have the drive-through, and so various industries. People have been concerned, and people have been reaching out to the office and trying to get some more information. I haven't dealt with disciplinary action and like that, but because in general people have been worried, concerned, but also been working with their employer. And now you see many of the cashiers, they have protective glass in front of them, and working, for example. Canada Post doesn't have that in their offices. So we've been pushing the government to make sure that we install that for our Canada Post workers also. So there's different elements there that we have to, but it is, I appreciate the concern, but we have to kind of, this morning, for example, I had a conference call with Fountain Tire There's 10 franchise owners across Ontario. They have regular 9 a.m. meetings with the owners and to brainstorm on ways to keep, because they're open, from a tire and car repair and truck repair. So they're worried about their employees, so that's part of the kind of that information that we have to make sure that we have enough protective equipment and we have find ways to keep people safe.
Okay. A lot of readers ask, what sort of work MPs are actually doing during this time. Can you just, I know you kind of, you've already sort of given us a picture of what you're doing, but given today's technology, does this allow you to sort of, preserve physical distancing while still being able to help your constituents?
Well, we even before this pandemic, I would meet people in the riding, and some people would say, "Oh, you're in the riding. You're on holidays. You're not in Ottawa. You're on vacation." No, and a lot of the work, most of the work, is done in the riding. For me, that's where I take a lot of pride on working on helping people and supporting people and organizations in Nickel Belt. So from a riding perspective, it's really, really important. So now with the pandemic, obviously in the morning, make sure I read up on the latest information that's going on to make sure I got the right information. I have 6 staff that we, still got to manage, and I touch base with them, and we deal with the voicemails and the emails and the social media that are coming in. So I got to make sure the staff are good. And then obviously then I have a list of constituents that I'm calling that are requiring specific information. I have also a list of businesses that have been calling. So they're calling in and returning their calls. And also reached out to all of our, I have 5 mayors from West Nipissing, St. Charles, Marc, Warren, French River, Killarney, and then the Greater Sudbury mayor also, and some councillors, just to make sure, any support that we could provide. I've been dealing with a lot of the French First Nations leaders to make sure their inquiries and are good. So dealt with the chief of police, talked to obviously Dr. Sutcliffe on numerous occasions to make sure that we have a handle on stuff. The airport, I've been also Sudbury Airport helping them to look at ways to navigate, because they're federally or provincially, but in general, as an MP, there's been a lot of work done during this pandemic, but I appreciate the concern that people have, but people don't necessarily understand the current day-to-day role of an MP. So that's part of the challenge that we have to always inform people. But at the end of the day, keeping busy, and then every single day have a conference call with cabinet and Liberal MPs across the country around 5 o'clock. And then another opportunity to make sure that what I've heard during the day and the concerns and suggestions, that I bring that back to cabinet to make sure that we get the feedback and they're hearing what's going on the ground. So a lot of that channeling of that information back to the government is important.
Okay. A lot of concern about you got a pay raise today, April 1st, as was legislated. A lot of MPs, including the Prime Minister and Conservative leader Scheer, are donating the amount of their pay raise to charity of some kind. I was wondering if you are going to be doing the same thing, and to where you're going to be donating your raise.
Yeah, no, definitely. We've heard that, some of the concerns and comments, and I appreciate that, because when you're dealing with taxpayers' dollars and elected officials, it's always a concern, or it's been brought up everywhere I go. Yes, for sure. I've already been donating to our local organizations, but this year, the specific raise that I received as of today will be going directly to food banks in Nickel Belt. And I would encourage anybody that has the means, even if it's $5 or more, to give to your local food bank, to give to the soup kitchen, because they are in desperate need of donations. So my raise will be going to the soup kitchens and the community food banks. And also, just to be clear for your listeners, I mean, since 2005. To remove the partisan aspect of this, the Canada Parliament Act was passed in 2005 to give a raise to MPs and senators And what the formula is, it's averaging out the collective agreements average of the private sector bargaining units. So this year, for 2020, it's 2.1%.
Okay. As you said, you speak daily with other Liberal members, with caucus, things like that. And the Prime Minister has gotten a lot of questions about, invoking the War Measures Act and sort of stepping up the sort of level of national emergency. Can you kind of explain where we're at with that and sort of what would have to happen for things to require, some more extreme declarations from the federal government?
I mean, we're already, with the Quarantine Act, there's already been quite a few measures put in place. But also, you got to remember, the provinces and the municipalities have the right and the powers today to lock down a city and lock down a province. Nova Scotia has done it. Major cities like Montreal, Toronto, and Vancouver. One size doesn't fit all. Like Northern Ontario cities are very different than Toronto. So right now, to do a national, as it stands today, to do a national War Measures Act or bringing in the army, I think it's not something that would be. I think it's better to localize. Each region is different, and that's where the Prime Minister, and we had I think it was Tuesday night, one of the conference call, the Minister of Defense Sergeant was there, explaining how the troops, military, are ready to respond to specific areas, either to build a hospital in Toronto or also this spring, as you know, in the last few years, we've got flooding and fires. So there are still concerns about that this year. So we got to make sure we have the Army ready to meet. But essentially, what's going to happen, I think, more in the short term is each municipality will look at their situation, and major cities will be clamping down even more. And then from there, we'll see the province. And then hopefully it doesn't get to that, like the US, but that we don't get into a situation where that we have to really lock down the country. So we'll have to look at, I think it's important to answer your question specifically, to look at region by region, city by city, before we look at the national picture.
I assume, though, that in those discussions, there is, the possibility that things may get dire or particularly bad. I assume those discussions are being had and contingencies are being discussed. Yes.
Oh, correct. I mean, was it Monday or Friday? The Prime Minister had a conference call with the premiers, and that was on the agenda. And not all premiers want this. I mean, at this point, so there's no wide support from the premiers. The premiers are saying, and they're doing a good job. They, look at Premier Ford. I mean, he's been doing a great job to try and make sure that the province here in Ontario and dealing with the information being transferred. So the premiers have a lot of the tools that are needed. So yes, it is being discussed. The Prime Minister has said it's on the table, but at this point, the provinces and municipalities have what it takes to kind of try and deal with this at a local level, which is the best way to deal with it.
Okay. Now I know he's your boss, but are you satisfied so far with the job that Prime Minister Justin Trudeau has been doing as the leader of the country in this sort of unprecedented time?
I thought you were going to refer to that's the real boss. So just want to be clear.
She's unelected, though, Marc.
Okay, that's good. That's good. Yeah, no, definitely. I think I'd be hearing from constituents about our Prime Minister and the daily conferences, followed by the ministers. And then obviously in our case, we have caucus. I mean, every federal member of parliament has also part of a conference call around 4:30 every day. And then the Liberal MPs also have a call also. So there's been a lot of information. I mean, it's difficult to navigate, but overall, I think our Prime Minister has shown leadership. I think not, and as you've heard him on a daily basis, it's really the heroes are really individual Canadians that have made sure to stay home, to make sure if they're working, to make sure you look at some of the measures to make sure that this doesn't spread more than it is. We know that, as you talked about the curve. It is important, but a lot of people have been staying home, have been respecting the social distances, the physical distances, and so I think when you look at individuals, and then you look at all the nurses and the healthcare professionals and the first responders. I can't imagine, and that's why when you look at specific measures that are legislated, the health professionals keep saying it's much better when it's volunteer, when it's people driven, when people are given the information, and because we got to keep our health providers and our first responders safe when they come to a house or come to an accident. So make sure that you tell people if you do have any symptoms. It's very important to keep them safe first.
Okay. Now, a couple of days ago, I want to just talking about leadership. A couple of days ago, the Boston Globe editorial board published an editorial which said, in no uncertain terms, that President Donald Trump is going to have blood on his hands in how the U.S. administration has managed the COVID crisis. Should we in Canada be concerned about potential refugees from the United States fleeing across, fleeing the situation down south to perhaps a more stable situation in Canada? We have a very porous border. There's lots of points where where refugees could stream across. Is this something that Canadians should be concerned about?
Well, the agreement that was struck between Canada and the U.S. just last week stopped any refugees, any people coming across the border, tourists, except for essential workers. So at the end of the day, everything that happens in the U.S. affects us. There's no doubt from an economic perspective. But our government has been focused on making sure that we keep the supply chain open, that we make sure that auto parts are coming in, manufacturing is still going ahead. We're making sure food is crossing the border. We're making sure pharmacy medication is crossing with our truckers. Thank God to all the truckers that are still daily crossing the border. I wouldn't worry too much about that, Mark. Refugees, that's been stopped at the border. If people are running across or in the bush somehow and getting through, that's challenging. But in general, no. That's been all stopped, and even the ports. So I wouldn't worry too much about that. We have to make sure that we focus on us here locally. And each region, each city, each community, to make sure that we remain safe and we control and manage the COVID-19.
Mm-hmm. Now, clearly, the provincial governments, the federal government have stepped up big with spending packages and things like that to keep the economy going, to ensure that people can pay the rent and buy food and that sort of thing during this crisis. Clearly, billions and billions and billions of dollars have been spent and are being spent on this. A lot of people, though, are curious, how we are going to pay for all of this once we're through the crisis.
Well, let's be clear, Mark, and I appreciate the question and some of the concerns that constituents have had. We've been in a good financial position. When we look at the Canadian economy, there's $300 billion in revenue that the federal government, over $300 billion. In the last few years, we've had less than 1% of that as a deficit. So we're one of two G7 countries. We're one of the top 10 countries in the world that still have the AAA bond rating. The US and the UK have lost that because of the overspending. We haven't overspent. So let's be clear on that. But now it's health first. So I think there's partisan agreement. Premiers are on board, obviously, all political parties on board. We have to do whatever it takes to make sure we have Canadians safe, and then we restart the economy. Prior to this COVID-19, the economy was very strong. We've had these conversations, and I've had conversations with many employers that are having difficulty finding workers. So that's the good news, that the virus, when we are able to control it, the economy will start where it was, but we're going to have to aid and have some stimulus packages to make sure that people are rehired and the economy gets back to where it was. And that is going to need dollars. It's going to need billions of dollars from the Canadian government to get the economy up and running. But right now, the focus is putting everything we have to make sure that we take care of the vulnerable. We make sure that, because some 21,000 in the United Way district here live in poverty. So we have to find ways to help people out that live in poverty. We have to make sure our healthcare workers are safe. We got to make sure that the economy, we keep the economy going, and then when the virus is under control, we put the stimulus up. So I would reassure Canadians that our balance sheet is strong, and having the added deficit, and obviously this year will be substantial, and possibly next year. It is important to do. But also, last point on kind of the investment. A lot of the investment that we've done in the past, we've done with roads, bridges, Highway 69. That doesn't last a year. That lasts us many years. A bridge lasts 50, 80 years. So a lot of the investment in our crumbling municipalities and roads are good for the long term. So that's something that I just want to make sure the listeners understand. But I think we're all on board right now. We need to do what's best to keep people safe. And then when we control the virus, we're going to look at investing in getting the economy up and running again.
I know we've seen it. We see it quite a bit on the. I'm just going to stick with this question of spending for a second, if you don't mind. And I want to see if you've heard the same thing. We've seen numerous comments and messages sent to us from readers saying, when it comes to protecting the economy and protecting Canadians from COVID-19, we have to be careful that the cure isn't worse than the disease. Which I was kind of wondering how. I'm sure you've heard a similar sentiment from constituents. How do you respond to that kind of that kind of criticism, that kind of rhetoric about about the situation we're in?
Well, I think this just shows in general that from a public health perspective, I think we haven't done a good job across the world, across Canada, across the provinces, on making sure that we have enough resources for public health. And this pandemic demonstrates this. We could have been and should have been prepared better with a lot of more PPE equipment for protective ventilators. Also, public health, we need more staff. We need more resources. So it's conversations I think we're going to have after the fact here with looking at our public health networks, and we have a good healthcare system, but I think the public health needs to, because we have to look at how do we have the equipment, how do we have more testing, and how do we make sure that we're possibly able to track better, because it's very easy for individuals, and I've heard it, just shut everything down, just put everyone in jail, we can't do that. So we have to find ways to educate people. We have to find ways to make sure that we have some staff and more staff that we have right now, public health. But those conversations I think will be had after this crisis and this pandemic. But my view is, and Minister Edu has also talked about this, is we're going to have to really sit down and look at some of our priorities moving forward. Especially when it relates to public health. And when you look at individuals that want to shut everything down, the police today, they don't have the funding to deal with the current crime that is happening. So it's something that we have to rethink how we're providing services. But on the health side, I think it's something that we're going to have to look at more of that funding, possibly to support local health organizations.
So basically, the cure can't be worse than the disease, I guess, is what you're saying. We have to do everything. Is that what you're saying? We have to do we have to do everything we can. Is that fair to say?
I'm 100%, Mark. I think right now, I'm proud to be Canadian. I'm proud of our health system. I'm proud of where we're at. But when you look at this crisis around the world, I think we have to do more, obviously, but. We definitely have to make sure that health comes first.
Okay. Now, I just want to dig into a little bit of Nickel Belt for a second, if we could. Nickel Belt is an enormous riding, as you can attest to. It's population centers are somewhat spread out. There's some people in very remote parts of that riding. Internet service in large swaths of your riding are spotty. at best, if available at all. And Canada Revenue Agency is pushing people to go to their website to apply for EI, to apply for, if you're a business owner, to get the benefits that you're entitled to, that sort of thing. But for many residents of Nickel Belt, that isn't an option to go online. Or going online is very difficult. So for those members of your riding, what services are in place to help them get the help that they need if they don't have access to good internet?
Yeah, well, this is not just part of the pandemic here. I mean, it's been over the last decade or so, a lot of the government agencies, provincially and federally, have gone a lot online, and so since being elected, I've been pushing back on that a lot in Ottawa. I've been chairing the National Rural Caucus, and we've been pushing back to say, hey, yes, digital and online is important, but a lot of rural areas don't have it. So essentially, for Nickel Belt, so what I'm saying with the residents that are calling in, and especially now this case in EI, Service Canada, for example, have closed their doors, but they've shifted some of the staff for the call centers to take more calls. So we're adding, I believe, close to 300 new phone lines on the call center. We're adding more staff to take the calls. So yes, go online if you can. If not, you still have the option of calling. And I know it's been challenging. We've had some calls this morning and yesterday again saying there's long wait times. Others have gone through fast, but there's still issues with calling, and that's always going to be an ongoing issue. But right now there's millions of people applying for EI with the new emergency, so this obviously is a bit abnormal. But in regular times, it's still a challenge for people in Nickel Belt and across Northern Ontario if they don't have access to internet to access government services via phone. I have seniors I've talked to several seniors with Service Canada, CPP, and so the staff have been working really hard on the federal, but they just don't have the resources to deal with that. That's why my office gets a lot of these inquiries. My office is there, my staff is there to help support, open up a case number with some of the staff or some of the individuals with the staff, and then we help our constituents, our residents to navigate through the process. But right now we're telling individuals, go ahead, apply online, or if you can't, then go ahead and call. But yes, there's going to be some wait lines. We've been pushing back our caucus meetings and bring this on a regular basis, that we need more phone lines and we need more people to answer the phones, especially in this group.
So basically, as frustrating as it is, a lot of people are just going to have to sit on hold until they get through, or keep trying until they get through. I guess that's what you're saying?
Well, we're doing the best we can with the resources we have, and I want to assure people in Nickel Belt that I've been raising this on a daily basis to make sure that we put not just resources on the online side, but we put resources in the call centers to make sure that we have people in remote areas, seniors that don't have access to the internet, to make sure that when they call in again. And there has been some movement on that, but probably not enough, what I've heard, but we're going to continue pushing to make sure that not just this pandemic, as we move along too, to make sure we still have that one-on-one service in certain areas.
Are there other issues that rural Canada is dealing with related to COVID-19 that you have seen and that you're sort of attempting to address?
Oh yes, we've heard a lot in rural areas and minor riding too, like tourism, the economy. They're devastated right now for the summer. So from an economic perspective, it's going to be very challenging. Also, what I've heard a lot in the small areas too, and across the country, I attend also the National Caucus, Rural Caucus meetings by phone, is traveling. So we have seniors, we have individual disabilities that are living in small areas, don't have the opportunity, they have friends, families around, so they need help to get groceries. So you'll see today on my Facebook, requesting information on which grocery stores is delivering to residents, because we're getting calls, and United Way is getting calls. Some seniors just don't have the means to go to the grocery stores, and so we got to find ways to make sure that that's happening. So we're getting a list of that. So the distance is, and also some of the organizations that are, for example, in North Bay or in Sudbury, where I'm also, talking to them on a regular basis to make sure that they do outreach to Dowling, to Levack, to Cape Creole. So, because even in Greater Sudbury, Nickel Belt, I represent 45% of the population of Greater Sudbury. And when you talk about Dowling and Levack and Cape Creole and some of the outlining areas, it's still a trek to get to downtown Sudbury. So how can the local organizations ensure that they have transportation to make sure that we cover seniors and people with disabilities and that are challenged in the outlining areas, not just in the remote municipalities like Killarney or Gogamo or French River or West Nipissing.
Okay. We've been getting a lot of questions. There seemed to be a bit of questions, some confusion from some business owners about the emergency wage subsidy for businesses. Can you briefly kind of just explain the subsidy and give us a few details on how it works and that sort of thing?
Yeah, so essentially a portal will be set up very shortly under CRA, the Canada Revenue Agency. So the employers will be able to apply. And essentially, like we'll give the example, there was 10% at the beginning. And I heard a lot of employers call me and say 10% was ridiculous. So I brought that information back to our conference calls to the ministers. And today, Minister Morneau clarified, and the last few days, obviously, the Prime Minister clarified, we're raising that to 75%. So essentially, as an employer, and it'll be retroactive to March 15th, and you'll be able to keep your employees on board if you've had a reduction of 30% in your sales month to month from, we'll say, April or March compared to March of 2019. So those are kind of the elements that employers will be, not all employers are able right now to hire, and some of them are hiring people. Fountain Tire, for example, they already have employees on place and many of the garages are open. So they will be able to access this funding. But right now it's in place for about 3 months. Depending upon the situation, that might be extended. But employers will have that, and it's open to small, medium, large employers. There's no cap on what the 10% had at the beginning. So that has been changed. So I encourage employers, the portal has not been set up yet on CRA, but we're, hopefully, my understanding within the next week or so, there'll be that portion to apply. But, again, look at Canada.ca, but also employers could go to Canada.ca and with a small business, and they could register and to get regular business updates from the government. So you're able to put your email address, and from the Minister of Small Business, Mary Ng, you'll get regular updates for your business on a regular basis. Okay. And also employers, obviously the banks. I mean, the banks have been kind of an issue to a certain extent, but we're pushing hard on banks to make sure that they can support businesses and individuals during this time. So that's something that I've heard a lot too from constituents.
What do you mean the banks have been a bit of an issue?
Well, the people they have to go to banks traditionally. When you look at mortgages or service charges, or I think in this time the banks need to step up a bit more than what they've done so far. So that's clear. That's what I'm hearing from constituents. So right now we've provided liquidity to the banks. We provided support to the banks. But now the message is each individual here, depending upon how you've been impacted, how your business has been impacted. So encourage individuals and businesses to go to their financial institutions to see if there is some relief for mortgage relief or loans relief in the next 6 months. But what I've heard from constituents is it's been a bit of a challenge sometimes with the banks. So we have to monitor that closely, and I'll be providing that feedback back to Ottawa, what I'm hearing locally. If individuals and businesses are having a hard time with the banks, I'm going to make sure I bring that back to Ottawa.
Okay. Canadians abroad. We talked about it a little bit earlier about the Canadians coming home. There have been some criticism of Canada's effort to bring Canadians abroad back into the country who may have been exposed to COVID-19. Why is Canada welcoming Canadians abroad back home rather than advising people to, sort of shelter in place where they are?
Well, that's a tough one. I mean, the Canadians, have a right to come back to Canada. So we've been encouraging Canadians to come back to Canada. We've been not just encouraging, but supporting them with, $5,000 if they have extra fares. We've been, getting airplanes to certain countries that will let us go in. Some countries we can get in. So I think Canadians expect us to do this. Yes, there's there's a few hundred of thousands of Canadians that were abroad. So the challenge is huge. The challenge is big. And the concern that you're bringing up and individuals have also brought up to my office is, what do we do when they come in? Do we quarantine them but we just don't have the space or to put everyone at Trenton or like we've done with the cruise ships. So we've asked individuals to make sure they stay home, they self-isolate, and for the most part, that's been happening. I mean, people have been really respecting. I mean, we've seen some of the few cases, but in general, people have been very respectful. And I talked to Snowbird yesterday, and he joked about I'm staying at home, self-isolating because he came from Florida to protect other people for the next 14 days. But after the 14 days, I'm still staying home because I want to be protected by the other people because I want to protect myself. So people are respecting that in general. So I think as Canadians have a right to come back to Canada, but we have to find ways to make sure that we have the proper information, to make sure that they are self-isolating. And when they cross on the airports, there was a lot of instances that there was not a lot of screening done. So I appreciate some of the concerns that people have raised on that. But in general, we're seeing a lot of that dissipating now with less people travel.
I wanted to ask about that because we did hear from a number of people who had come back into the country saying that, the COVID screening at airports or borders or whatever was minimal, amounting to little more than "Are you feeling okay?" Did you hear those same concerns? And what was going on there?
Well, I heard some of the same concerns. I mean, it was just to turn around the whole bureaucracy, to turn around the airports. It just took a bit of time. But again, Mark, I mean, people were hearing about this virus all over. So it's not fair to say that, no one asked me at the border. There was still a lot of information out there. But it was an issue in the first few days for sure, yes.
But it's no longer an issue as far as you know?
No, I mean, we now have the 4 airports taking people in across the country, and even a week ago, I mean, the screens on there's been a lot more enforcement and happening at the airports for sure.
Okay. Something that was raised today, and I wanted to raise it with you. It was raised with the Prime Minister at his daily morning briefings that he has been doing from Ottawa. But I wanted to ask you, Dr. Anthony Fauci, the top infectious disease specialist in the U.S., has said in a recent interview that the United States could expect anywhere from 100 to 200,000 to maybe 250,000 deaths as a result of COVID-19. Now, the Prime Minister so far has refused to put a sort of a similar kind of potential range of casualties to COVID-19. Why isn't the Prime Minister just, providing Canadians with it could be this bad sort of situation?
Well, I think we've heard from Dr. Tam about different scenarios, flattening the curve, social distancing, like what's happening today will affect our numbers in 14 days from now. I think that's a very difficult question to ask. I mean, maybe Dr. Fauci in the U.S. Has to deal with the current president going sometimes in a different direction. Maybe he had to pull in some of those numbers. I think in Canada here we've been more consistent with the premiers, the Prime Minister, the public health Dr. Tan and the individual public health, there's been more consistency here. I want to assure Canadians that we are on this. I mean, we're trying the best we can. There's no partisan issues here. We're working closely to make sure that everyone is safe. So providing numbers is a challenge in this situation. But the key here is to look at what can we do locally to make sure that we do our physical distances and we do what we need to do here locally. From a Prime Minister's perspective with numbers, I think it's hard to get a clear because if individuals don't respect the social and physical distancing, we'll see a spike in numbers. But right now, I think we're seeing Canadians really pulling together, and people in the north here, especially, you could see that there is some good information out there that people are respecting.
Mm-hmm. I mean, I can. Sorry, I don't mean to interrupt, but I mean, I can understand, not wanting to frighten people. But when you have, a certain segment of the population who either, thinks that COVID-19 is a hoax or doesn't think it's that serious, is it not possible that providing or, saying, this is the worst case scenario that could happen if we don't flatten the curve, could maybe convince some of those people who are on the fence about COVID-19 not to take it seriously?
Well, I think our Prime Minister has been clear that this is serious. I mean, and you hear in the media today, you have nursing homes, fatalities, you have individuals in their 30s that, so it's not just on older, there's younger people also dying. I mean, so we're hearing daily briefings on premiers about this and so if people today, as we speak here, think this is not serious, they should really consider their thought process. Because there's been a lot of information here. I mean, and you don't need to just focus on Canada. Just open Italy, Spain, and the U.S. By large, I mean, we have been doing a good job on respecting and managing this crisis. Individuals have done a good job here on the social distancing. So I think, for that, provide a number is not going to change things, Mark. I think we got to continue with the information that we have now and do the best we can.
Okay. Supply lines. A lot of Canadians are concerned, about supply lines being kept open to keep food and medicine and products that we need in stores, in hospitals, that sort of thing. Can you talk a little bit about how the federal government is working to ensure that those supply lines stay open?
Well, this is very important. I mean, we've been doing this. We'll take an example like today, well, not today, but in a regular non-pandemic day, $2.4 billion a day crosses the U.S. and Canada border. So our government has been really active in ensuring we have that communication with the White House and the governors. For example, 35 states in the U.S., Canada is their number one customer. So a lot of the governors in the U.S. know that the supply chain open is important. So we've been making sure. And last week we got the agreement to make sure that we continue with the essential services between the border to make sure that the supply and services continue. Yes, so I've heard, and even on the call this morning, truck drivers, what is in place when they're crossing the border? Employees, truck drivers have to self-monitor. The employer is also responsible to talk and monitor that with your employer on a daily basis. But we've got to thank our drivers crossing the border every day for food and medicine and our supply chain. So the government has been making sure that the border stays open. There is no, U.S. Army coming in to monitor the border. That's not going to happen. We have a very, very good relationship with the U.S., as you know, and we've been really, really concerned about it, but we're also working hard to make sure that we keep the supply chain open between the two countries, because it's the largest trading partners in the world between two countries is Canada and the U.S. No other country trades as much between two countries as we do. So that is continuing. There is no plans to shut that down. We do have an agreement. with the U.S. But I know Canadians are concerned about the number of COVID-19 infections in the U.S. So we got to kind of monitor that as we go along. But at this point, we're working hard to make sure that supply chain is open, pharmacies and food, and there is no shortages. So we don't need to go and that brings up a good point, Mark. I just want to mention grocery stores. We have shelters in the area. I received calls from a few shelters, and they've been going in to buy supplies for like 20 residents, and they've been limited, like every individual, because of individuals hoarding a lot of info. So I had to call some of the grocery store owners and telling anybody listening here, please, if a shelter is going to your grocery store, let them bring in a bit more than what the quality, because right now you're limited to 1 bag of milk, you're limited to certain supplies, but a shelter can't go back every day, or they had to go back every day in the last little while. So make sure that the grocery store has a bit of flexibility for individuals that are in shelters and going to buy food and supplies for them.
Okay, that's good information. So now, the several major media outlets have reported that internal government documents show that measures that Canada has put in place to prevent the spread and to support Canadians financially are, this isn't going to be a matter of weeks. This is going to be a matter of months. Can you talk about that? I mean, at the outside, how long does Ottawa think this situation is going to last?
Well, that's been asked on a daily basis. I mean, no one knows. The short answer is we don't know. But what I would have said correct. What I would have told you last week, I thought this would have been better under control by now. I was hoping. So I was hoping that probably within a month we could start easing the physical and social. But as of this week and today, I think we're in it for several months of exactly what's happening today. That's my personal opinion, but I think the BC medical health officer also indicated that we're looking possibly June, and some said summer. But the key here is if we could find ways today to make sure that we stop the spreading of this virus for the next, so that we could, have it under control by June, then we can enjoy our summer holidays, we can enjoy the summer. But right now we need to really clamp down, and we're asking all Canadians to really make sure that we take the preventive measures now for the next few months to make sure that we have the summer. Hopefully we have this under control. But Mark, I can't give you any more specific numbers than the Prime Minister and the health. This is an ongoing, but I know that the numbers have been still going up. So the curve is and the health system, the hospital are managing right now. But nurses and doctors are getting tired and they're working long hours. So the more that we as individuals, if we don't want to do it for ourselves, do it for our workers, do it for our first responders and our health providers, to make sure we flatten that curve in a big way, because this could last quite a while.
Okay. One last question, Marc, and then Mr. Serré, and then we'll let you go. But Quebec has taken some drastic steps to close off northern and more remote parts of the province to traffic to really try to limit the spread. In Ontario, we're seeing numbers really starting to explode in Toronto and around and in southern Ontario in the Golden Horseshoe, and that really densely populated part of Ontario. So far, Northern Ontario, I mean, the cases are going up, but they're going up much slowly, and we have much fewer cases. Today, we ran a column from Dr. Peter Zalen, who's the former president of the medical staff at Health Sciences North. Dr. Zalen says that now is the time to start closing Northern Ontario off to everything but non-essential traffic to really ensure, really to protect the region from these explosions in COVID-19 cases. Do you think that it is time for us to take that kind of step of closing off Northern Ontario to all but the most essential traffic, supplies, medical supplies, that sort of thing?
Yeah, I had that conversation with Dr. Zalen on Monday. He's pretty adamant on suggesting this. I mean, I've heard this from mayors in some of the small towns that are getting tourists back. So people from Southern Ontario are now moving to cottage country, and Nickel Belt is one of the most beautiful areas for cottage country. So there is concern. There is concern that Southern Ontario coming in. So what I've talked with the Dr. Zilin and what I'm saying here is, at a certain point we may have to do this, but the municipalities have the powers to do this. So it's not like an emergency, national emergency that has to be called upon. But at this point, I'm not advocating that. I think we have the resources and the education to try and manage this from a Northern Ontario perspective, or individual cities. Closing down completely in Northern Ontario, I think, is cautious about, because you still look at the supply and services and food, and I don't think it's necessary at this point. But we have to monitor this closely and work with our health units and work with the local mayors to see. But there is concern about Northern Ontario getting, I would say, infected by people from Southern Ontario. But at the end of the day, I think it's something that we have to try and manage locally and do the best we can to ensure. But clearly, it is a concern. But I'm not advocating that right now. No.
Okay. Is there anything else you'd like to add today, Mr. Serré?
Well, no, I just wanted to, to finish off, I guess, in summary, to make sure that, a big shout out to all of our healthcare workers, our first responders, our clerks and cashiers, construction workers, minor people that are working right now, the unions that are working with their members to make sure that continues. I mean, this is unprecedented, so we got to make sure that we shout out to them and support them with proper protection. Obviously, the physical and the social isolation, I can't stress that important. And I know it's hard to go visit grandma or go visit or not to go visit, but please don't. I mean, I call my mom every day, but I don't go visit her. I visit her once just to provide some food at the door, but that's it. And so make sure that we do that. Also, go to 211.ca, and there's a lot of, you can call that's funded by United Way. There's a lot of information provided there for people individually in their local areas. So that's a good resources to go, and then obviously encourage people to give, to people that can give. Please give whatever you can to the food bank or to the shelters. They really need your help right now, because and I guess the last point is to make sure that please stay safe. Respect the social distancing, and wash your hands. I never know how to properly wash my hands 30 seconds like we've done now, and that's a good point, because listen to your mom and grandma when you're growing up. Don't touch your face, don't pick your nose, wash your hands. All of that applies today. So that's what I tell people, to respect that. And so it's just I just appreciate it. And again, our offices are open. Please make sure you follow through with any information you have, and we'll do the best we can to respond as quickly as possible. So stay safe, and thank you, Marc, for providing your viewers and your readers with more information.
Marc Serré, MP for Nickel Belt, I appreciate you joining us on Sudbury.com today. I'm sure we'll be reaching out to you again over the weeks and months as this pandemic continues for further updates on what's happening in Ottawa and what's happening in Nickel Belt. So I appreciate your time today. Readers, I appreciate you tuning in. We're doing our best to provide you with all of the information that you need right now to keep yourself safe, to keep your family safe, to get the resources that you need to get through this. Head to Sudbury.com for the latest in news. And Mr. Serré, thank you very much for joining me today. For Sudbury.com, I'm Marc Gentili.